Hi there, this is Dr. Jenny Yoon. Welcome back. Today we're going to talk about breast cancer that affects young women. When I say young women, we're talking about women under the age of 40. Breast cancer used to affect older women in their 60s and 70s, up until about a decade ago. Now that has changed. Now we're seeing more and more young women being diagnosed with breast cancer. The youngest one I diagnosed about 2 months ago was 24 years of age. There are about 12,000 women under the age of 40 diagnosed every year with breast cancer. It is now the leading cause of cancer deaths in women under 40. This is scary, not only because it's affecting very young women, but because breast cancer that affects young women usually get diagnosed late, meaning the cancer is larger at the time of diagnosis, and by the time we diagnose it, it has already spread to other body parts. The reasons for this late diagnosis is because we don't really screen these women for breast cancer. As you remember, mammogram starts at age 40. So if you're 30, 20 years old, we don't do mammograms. And often these women present with focal symptoms like a breast lump or a discharge that brings them to a doctor. The other problem is a lot of the doctors out there have this misconception that breast cancer doesn't occur in young women, so they tend to dismiss these symptoms, which further delays the diagnosis. So all of these translate into poor prognosis and poor survival rate. And breast cancer that affects young women are also more likely to be inherited, meaning remember the BRCA1 and BRCA2 mutation we talked about on the first program. For women under 40 who are under 30 who are diagnosed with breast cancer, they have about 28% chance that their cancer is due to a genetically inherited mutation. This rate of mutation gets much lower when you're talking about older women. And another thing that is complicated with breast cancer that affects young women is treatment process is a lot more complicated. Older women, we cut it out, we treat it with radiation or chemotherapy, but though it's not as simple in young women because you have to consider their fertility issues, sexual dysfunction that comes with treatment, and some of the chemotherapy drugs can damage the heart and it can leave lasting effects on the brain. Most doctors out there advocate for these young women treating them with chemotherapy to shrink the tumor first, and then they cut it out with surgery. Also, by removing both ovaries when they're young, it also increases their survival rate. But the problem with taking the ovaries out or treating them with drugs called tamoxifen and drugs like that will put these women in menopause even though they're maybe in their 20s and 30s. That means these women get symptoms from this menopause, which can include hot flashes, headaches, osteoporosis or bone loss, and infertility. And some of the chemotherapy drugs can cause leukemia later on. So if you're a young woman who are diagnosed with breast cancer, you need to consider the following things before you get surgery. First, you need to consider getting a genetics test to see if your cancer was caused by this inherited genetic abnormality. You need to talk to a specialist about fertility if you still want to have babies after you get treated. And if you're done with childbearing, then you need to think about removing your ovaries because it helps with the survival. And you need to talk to your doctor about osteoporosis or bone loss that can result from your treatment. You need to also think about sexual dysfunction and learn about how to treat that. Sex may not be important to you now that you're undergoing treatment for this serious cancer, but it becomes important later on when you're trying to resume your normal life. And if you need emotional help, it's perfectly fine for you to go get psychiatric help to help you deal with this cancer and treatment and all the issues that come with that. It's not easy dealing with breast cancer, life and death, when you're just beginning your life. So you need to go get help if you feel like you need that. Optimal and careful planning before you actually undergo surgery will help you live better life when you get through this treatment. The key is you can't really jump into surgery. You know, when somebody tells you you have breast cancer, it's natural tendency to just take it out because you feel like it's growing every minute that you have it in there. But the fact is that cancer that you have didn't grow overnight. It took months or sometimes years to grow. So taking a couple of weeks, 3 weeks, maybe 4 weeks to get all this information, talk to multiple specialists, and lay out the best plan for your treatment is not going to make your cancer grow bigger. And you owe it to yourself to take this time and do what's right. Because once your body has been altered, you can't really undo what has already been done. Remember, breast cancer can be cured if diagnosed early. And in order to diagnose breast cancer early, you have to do 3 things. Self-breast exam every month, get a mammogram if you're old enough, and see a doctor at least once a year. That's how we protect the girls. This is Dr. Jenny Yoon. See you next time.